I'm joined by Dr. Craig Allen, the medical director at Rushford, one of Connecticut's leading providers for addiction and mental health services. It's part of Hartford Healthcare. Thank you for being with us, doctor.
Thank you. Thank you, Cara.
Is this pandemic fueling more alcohol and drug dependency? Is it making it worse?
I think it is. I think that the sales that we see, an increase of 50% of sales of alcohol, that's probably going somewhere. The environment of loss, people losing jobs, people losing access to their regular activities and their routines, the stress, the anxiety, the worries about one's health and the health of family and friends. These are the kinds of things that drive people to try to feel better and try to decrease that affect. And substances, they at first they can work for that kind of thing. So people drink and they feel less anxious. Maybe they can go to sleep. They might feel a little bit better. Of course, that only works for a short period of time. And during a time when we're trying to stay healthy and build up our immune systems, it's the opposite of what we really should be doing.
Right, as we know, alcohol really is a depressant, although it doesn't probably feel that way when people are just trying to take the edge off. So have you seen a rise in hospital visits with those fighting addiction?
Frighteningly, we've seen a decrease in people reaching out for help, both on our phone lines and in person. We've seen fewer people coming in. I think that the fear of the virus is keeping people away from healthcare facilities and substance use facilities, and I'm worried about it. I think also people don't realize that like Rushford and the Behavioral Health Network here at Hartford Healthcare, we're open for business. We'll do it virtually. We can meet with you via telehealth. You may not need to come in at all. And we can still provide a very helpful service, not just with our clinicians who will meet and talk to you, but also our psychiatrists and our nurse practitioners can prescribe medications via telehealth, and also our recovery support specialists, people with lived experience and specialized training. They're there and they can talk to you. If you're involved in one of our programs, we've been reaching out to our clients because some of them we're not hearing from. So I'm actually very anxious about that. I don't think it's gone away. I think it's in the shadows, and we're going to see a rebound, an unfortunate rebound, and we need to be ready for that.
Especially as we talk about a peak or a second wave. Doctor, thank you for being with us, and we'll make sure that everyone knows that they can call those numbers and that telehealth is available. So thank you for sharing that message.
Thank you, Cara.